So, what is SPD? SPD stands for sensory processing disorder or a sensory integration disorder and is not in the DSM but is classified as having issues interpreting, detecting, and responding to stimuli, including touch, taste, light, movement, noise, and smells. It is often comorbid with ADHD, anxiety disorders, depression, and autism, but it is its own disorder. You can have SPD with one sense or all of the senses at the same time, and it is more commonly diagnosed in males than females, especially in children. A person who does not have SPD when being exposed to stimuli does not have any abnormal reaction to it, and a smell is just a smell and a noise is just a noise. It doesn't affect their daily functioning. Sensory seekers are those who crave senses more than others, such as wanting to put everything into their mouth, touching everything, or wanting to listen to sounds all of the time. Sensory avoiders are those with SPD who want to run away from external stimuli. Sensory avoiders can get agitating from an overwhelming amount of stimuli and can experience sensory overload, resulting in temper tantrums, crying, panic attack, etc. For example, being in a classroom of noisy teenagers can be white noise to one person, but to a student with SPD, it's extremely overwhelming, even if it's just one or two students talking. Also, you can be sensory avoidant in one sense, but at the same time be seeking in another sense, or vice versa. There are many different types of SPD, such as proprioceptive, involving bodily contact, visual, looking at things, vestibular, involving movement like running or jumping, oral, putting things into your mouth, auditory, listening to sounds, tactile, touching things with different textures, and olfactory, involving smells. And since not many people have a proper sense of its etiology, it's harder to treat. However, exposure therapy and occupational therapy can help SPD's symptoms. Stimming or self-stimulation is also great for people with SPD, including using weighted blankets, aromatherapy, or exercising. SPD can seem like it's hard to live with, but if you know what to avoid or what to include into your daily life, it's manageable and you can learn how to function with it.